Now, before the case gets this bad, let's look at some of the potential risk factors that might give us a clue that we're going to be dealing with a surgical colic. When talking to a client on the phone, you may already have some ideas about the type of colic that you expect to find based off of some risk factors. By no means are these guaranteed, but some risk factors have been associated with certain types of colic and are worth reviewing. Cribbing, for example, creates a negative pressure in the abdomen, and this means that this suction can pull the intestine out of their normal anatomy, getting a right displacement or perhaps the small intestine pulled through the epiploic foramen. In older horses, we don't know why it happens, but they are at risk for these lipomas that can acutely get wrapped around the small intestine. Donkeys, they don't show very much. They are so stoic that sometimes you might have an impaction that's actually been ongoing for a little while. These cases might need more aggressive care and more aggressive treatment, and you then combine it with owners that may or may not be willing to spend as much money on that donkey's medical care or take them to surgery. These sneaky colics can absolutely demoralize you when you realize that you've missed one. And moving on to warm bloods, they seem to have a really large nephrosplenic space that just wants to have the colon sit in it. So common actually is a nephrosplenic entrapment in a warm blood that there's even a prophylactic surgery to close the nephrosplenic space using laparoscopy that is now available in some referral centers. Pregnancy loves to wreak havoc on our bodies in the best of times, and with colic, it's no surprise that the colon can get bruised or the uterus contors as the fetus jumps around. And then after foaling, that big empty space is prime for the colon to decide to spin around and twist. Male horses do have their challenges too, especially intact males, with large inguinal rings, a perfect spot for the small intestine to herniate. And the good news is, though, is that it is very acute, it is very painful, and it's extracorporeal, which means that you will notice it, and notice it faster than most other types of colic. Other risk factors involve the management or the environment of the horse. If a horse has been unable to move by being under stall rest or has been on a trailer for a long time, the decreased activity and the increase in their stress can alter their gut motility. We now even know that transportation can lead to a dysbiosis, which contributes further to that abnormal motility. All that abnormal peristalsis means that the ingesta isn't progressing through, you get a stagnation, you get gas buildup, or even an impaction. When the ingesta isn't masticated properly, it makes sense that it reaches the stomach or the intestinal tract in an inefficient manner, and that big bulk can clog the exit and lead to an impaction as well. Bolting the food, same thing, it's too much food arriving at one of these exit stages all at once. We also know that weather changes, winter, feed changes can be associated with colic. The mechanism is a bit complex, with some horses having a really hard time and others never being bothered by a frozen water pail or a sudden pasture growth after rain. But also, depending on your practice location, you may also want to keep in mind that grass sickness in the UK, for example, or sand and enterilis like in Colorado or California might be another more common cause of colic. Other areas can suffer from all of these different colics too, so be sure to keep them in mind until you're comfortable with what is and is not common in your practice area. With colic, there is a lot of pressure on figuring out where the problem lies. So we spend a lot of time on the abdominal exam, the auscultation, tubing, ultrasound, and rectal. And it's great if we can actually find the cause, because it's a lot easier to convince the owner of what needs to be done next. But we also need to pay attention to the hemodynamic findings, as they tell us a lot about perfusion and the systemic compromise. A critical colic may not present in intractable pain or with an obvious volvulus, but if the cardiovascular system is suggesting an endotoxic shock, then that case needs to set off the same alarm bells too. The rectal exam is essential as your first glimpse into the abdomen of the horse. So much information is gained from this examination that a thorough look can almost solely decide what your next action plan is going to be. The rectal exam needs to be set up properly to be successful. You need to use sedation and restraint, halter, a lead rope, a helper. You can also use stocks or some bales of straw that might help. Buscopan and butyrylscopolamonium bromide, but let's be honest, we all call it Buscopan, can be used for this and works as a short-acting antispasmodic to relax the rectum and the colon, reducing that peristalsis, which can significantly improve the quality of your rectal examination.